Once again, yeah, so we will be recording this, and I'm sure nobody has any objections. Uh, Thank you all for joining us. My name is Sajid Thomas, and I'm the Chief Child Protection for UNICEF Gulf Area Office, and I'll support with the moderation for this webinar. One running theme that you will keep hearing, I'm sure, is mental health for all by involving all. Yeah, this is something I think a few years ago um, came up a lot. And I think by joining us in this webinar, all of you are in a way saying that we want to be part of this journey for addressing mental health and psychosocial well-being. So once again, thank you very much. Let me also, on a personal note, I spent about 5 years at the UNICEF headquarters working on mental health and psychosocial support. So just so happy to see these levels of events happening at different regions, countries, and sub-regions. So very, very encouraging. And the participation itself is very, very promising. Logistical announcements, you have seen in the chat box. Translation is available in Arabic. So please go and choose your channel if you prefer to listen to the panel in Arabic. Also use the chat function and the question answer box for engagement, not just for the panel discussion, but throughout. So we really, really welcome participation from you throughout. We have a wonderful panel today. Some of the leading names in mental health, some of the top policymakers, policy influencers, experts, and practitioners. And I'll introduce the speakers when it is their turn to speak. But just to say that, for this region, we have some of the topmost people, both in terms of technical content, but also policy influencing. So that's really, really, welcome. Today's webinar would be split into roughly 3 parts, I would say. The first 16 minutes or so is about opening remarks and setting the context. So we'll have, Her Excellency Falasi from the Supreme Council, setting the context, a partner with a lot of focus on mental health in the country. And we'll have Dr. Dena, the resident coordinator, helping us with the UN perspective on the issue. So that'll be the first part. Then you have the more technical panel addressing directly the focus of today's webinar, which is investment, access, involvement by all. So, Dr. Shekhar Sheshadri, I know him from India days. You mentioned mental health in India. The first name that comes to your mind is Dr. Shekhar Sheshadri. So I'm really, really happy that he's able to join us and kind of give his insights. Both, he's quite active in the field, and he's also a professor. So he can kind of give us a blend of practical and, theoretical grounding for what we do. We also have Dr. Saed Khalid from the regional office of WHO, giving us a perspective on investment in this. I mean, the brochure that we send, the invitation we send, speaks about the cost of not investing in mental health, and I think that's the call that he would draw our attention to. The last part would be people in really management positions, with significant influence. Eltayeb from UNICEF, Rayana from WHO regional office. Just concluding observations, drawing mainly from, the discussion that preceded, but also from their, role as regional managers. So, and that would be a nice way of concluding this. And after the second panel discussion, there'll be about 20-25 minutes for actual engagement, question and answers. So please feel free to, send in your questions, make your comments, and we would go back to the panelists, in fact, all of them, as we move on. So with that, I think we will move on to the introduction. And I would like to introduce Her Excellency Reem Al Falasi. She's the Secretary General of the Supreme Council, a council with a lot of mandate on the issue of mental health and psychosocial well-being. UNICEF already has a work plan with the council on addressing mental health and psychosocial well-being. And I'm sure she'll have a lot to, contribute and bring our attention to. She is part of a number of high-level committees in UAE. I won't go into each of them, but quite a few high-level committees involving both the government of UAE and the UN. And she is someone that we really look up to for guidance on how we can engage in the country. So with that, Her Excellency Reem Falasi, over to you.
Thank you very much, Saji, for the introduction. Ladies and gentlemen, it gives me a great pleasure to deliver these opening remarks on the occasion of this special webinar to mark World Mental Health Day. I'm very grateful to all those who have worked so hard to arrange the event, including the World Health Organization, UAE Desk Office, and the Gulf Area Office for UNICEF. They truly deserve our thanks. The issue of mental health is one of huge importance, both locally and globally. It is indeed one to which the chairwoman of the United Arab Emirates Supreme Council for Motherhood and Childhood, the mother of the nation, Her Highness Sheikha Fatima bint Mubarak, has devoted much attention. It affects all sections of society. Women and men, young and old, rich and poor, all can face the challenges posed by mental health. Today, our focus is on the challenges faced by our children. Those challenges can arise for many reasons. Addressing them is something that is an essential part of any society that genuinely cares for the well-being of its citizens. And who is more deserving of our special care and attention than our children? Some are born facing the challenges. For others, they may emerge as a result of the varied stresses of day-to-day life. Here, of course, poverty and deprivation or the impact of conflict can have a major effect, and they may emerge too, sadly, because of the way in which we as human beings treat each other. One of our recent initiatives at the Supreme Council for Motherhood and Childhood, for example, has been a campaign against bullying in schools. Bullying is a phenomenon that can have a devastating effect on children, not just in physical terms, but in terms of their mental and psychological health as well. Its effects can last well beyond childhood into adult life. Our campaign is designed to instill in our children basic principles and values that respect and accept others, rejecting all abuse. That is part of building a tolerant society in which all receive the respect to which they are entitled. I'm delighted that our bullying prevention program, launched back in 2014, has received enormous support from across the education sector in the Emirates. In fact, we have just announced an extension of the period for nomination for this year's awards because of the level of that support. The UAE has always been keen to protect and to cherish its children, so that they may be equipped with all that they need to live a happy, productive, and decent life. For that to be achieved, it's essential that we care not only about their physical health, but about their mental health as well. Last year, our council ventured overseas with the launch of a special program on mental health in a refugee camp in Jordan. For over 9 years, millions of Syrian children have suffered from conflict, living through horrors of warfare and deprivation that no child should ever have to face. Is it any surprise that many of them have severe problems related to their mental health? Both of those initiatives by our council are, of course, intimately linked to the main issue we are discussing today, mental and psychological health in childhood. There is complete agreement amongst everyone that the most important phase of human life is childhood, particularly the early years. That is when the basis of an individual's psychological and mental health are laid down, when the roots are planted. The mental and psychological health of children is the most crucial component in the development of their knowledge and personality. In assessing that process, there are a number of key factors. First, the state of the mental and psychological health of children depends entirely on their surrounding environment, in both a positive and a negative sense. That environment must be one which is conducive to a good state of mental health. It must be based on love, intimacy, passion, and trust, capable of enhancing the knowledge and skills of the children. Thereby, both children and their families can live a positive life. It is widely recognized that the best way to guide and assess children's health is through assessing the dichotomy of normal and abnormal, the positive and the negative, that may be presented in problematic behavior. Each aspect is generally characterized by certain features and traits of behavior, usually produced by certain factors and generally leading to more or less similar results or effects. The evidence of abnormality of child health can be identified by the presence of behavioral disorders like episodes of anxiety, repeated bursts of anger, sleep disorders, headaches, and abdominal pains. In addressing those challenges related to the mental health of children, one of the most important aids for us is that of the developed models and techniques currently being used where necessary to guide professional intervention in mental and psychological treatment. As is well known, the psychological therapies used include children and adolescents therapy, well known for its widely used technique, talk therapy. Talk therapy models include cognitive behavior and dialectical behavior therapy. These are generally used to treat a wide variety of disorders in children, including emotional, acceptance, adjustment, anxiety, depression, grief, anger, and eating disorders, as well as attention problems and other disorders. A newly developed approach in dealing with children's psychological disorders is what is referred to as mental health first aid. This has the objective of providing individuals, families, organizations, and all those concerned with caring for and the bringing up of children with the elementary knowledge and skills to guide and to assess. It can also act as a kind of whistleblower, allowing for the need for intervention to be identified before cases become more developed. All of these techniques can help us provide better care and attention for children who are facing differing mental and psychological health challenges. That is of increasing importance today as we look at global issues related to mental health. We are now confronted with new and unexpected additional challenges. In recognition of that, I'm pleased to announce that the Council will be organizing a special event next year on the theme of mental health in general and mothers and children specifically. The Fatma bint Mbarak Motherhood and Childhood Forum 2021 will be held in Abu Dhabi on a date to be announced later. In announcing this event, I pay tribute to our chairwoman, Her Highness Sheikha Fatma bint Mbarak, for her consistent support and encouragement for all initiatives that seek to promote the interests of mothers and children worldwide. This initiative is of particular importance because we are now confronted with new and unexpected additional challenges. The coronavirus is having an effect on the mental health of countless millions of children, those who are suffering from the illness itself, those who are having to cope with the death of their loved ones, those whose parents have lost their jobs and sources of income, who are worrying about their very survival and their ability to care for their families. Children who are no longer able to meet up with their friends, all these and more are facing new threats to their mental and psychological well-being. The issue of mental health is a global one. It is moreover one that can affect anyone at any time. It can come upon us unawares, unexpected. It is too an illness around which there can still be a stigma, a sense of shame at what is seen to be a weakness, so that many of those who suffer, children and others, feel unable to reach out for comfort, assistance, and healing. It is my hope that this important event will help to break down the barriers of silence behind which so many are suffering. Our children, yes, they are the focus of our discussions today, but older people too. It is time to acknowledge the extent of the problem, time to look towards a world where well-being is seen as both a mental and a physical objective for all. Time to extend the helping hand, time to offer compassion, and in that there can be both a challenge and hope for all of us. Thank you.
Thank you, Her Excellency Rim and Falasi, for that very engaging introduction. The announcement of the mental health forum, I think it's very welcome, and I think there'll be a lot of interest, I'm sure, both in the country, in the region, and globally. So really welcome that. You did refer to a number of themes, which I'm sure will come up later in the discussions as well. The work on bullying, which has already taken place, and I'm sure there'll be more of it in the months to come. You also interestingly referred to work outside the country, the work that is being supported in Jordan. And I think that's, in a way, the spirit in which we have this conversation. So it's not about mental health just in the UAE, but also going much beyond the country and the region. So really welcome. And my last point, the point that you made about psychological first aid, so there is a lot of substantial guidance globally available on psychological first aid. And psychological first aid trainings can be imported to just about anyone. So I think that's one way of making sure that we take care of ourselves, but also take care of people around us. So thank you very much for those opening remarks. With that, I'll move on to Dr. Dena Assaf. Of course, the United Nations Resident Coordinator for UAE. She's also the Deputy Commissioner General of the United Nations at the Expo 2020. So a big responsibility, and now I'm sure it is 2021. She's been with the UN for over 20 years in various senior management positions, advisory roles in UN headquarters, Arab region. So a wealth of experience. So Dr. Dena, we look forward to hear from you. Over to you.
Thank you very much, Saji. You can hear me well?
Yes, we can hear you. Go ahead.
Okay, excellent. First of all, thank you for this invitation, and I'm very glad to be with you today. I want to first say thank you to Her Excellency Rim Al-Falasi and the Supreme Council for Motherhood and Childhood for supporting us in this very important event with UNICEF and WHO. The speech that was just given highlights the importance that the UAE provides to mental health, and I want to congratulate them for the efforts that they put so far and what will happen in the future. And we look forward as the United Nations in continuing to support the UAE. So thank you, Your Excellency, for your intervention. I have a few remarks, and I hope that this will help to provide a frame that goes beyond the specifics, which I will leave to our technical experts to enlighten us. This year is the 75th anniversary of the United Nations. And as the 75th anniversary, we are having a series of engagements across the UAE, this being one of them. And so again, I want to thank my UN colleagues for initiating this engagement for all of you. And it's really important for us as the United Nations to have a global conversation around important issues that affect all of us. And mental health, as we've indicated, is one of these very critical areas. The COVID situation has made that even more explicit for all of us. Even though we knew it was important before, the situation that we're all in now around the world together under the COVID has shown that mental health is not something that can be ignored and is not only for some people. All of us get impacted. And I have to say, and just being very frank here, even myself, and I say it to my own team, that being isolated and quarantined and so on, I say, I don't feel the same. This is not a normal situation for any of us. And we need to recognize the impact that mental health has, And I look to our team who's going to be speaking today to speak about the spectrum of mental health, that it is not one definition. It's a very complex and wide aspect of our health. As part of our UN75 conversation, and I'll remind you again at the end of my intervention, we actually have a survey which allows all of you to indicate where you see the priorities of the world moving forward at UN75.online. So I recommend that you go there to speak your voice, and we have a good representation from the UAE. But the UN75 dialogues that we are also undertaking now help us to reflect, think, and reignite discussions that maybe in the past we haven't given enough attention to, and to also look at where the gaps are now for a better future. In the United Nations, before the COVID pandemic hit us all, we had the slogan in the sense of the world we want. So we all recognize that the SDGs, the Sustainable Development Goals, have provided us targets and goals to work towards. And we wanted to have this conversation with everyone in the world to say, reprioritizing within this last decade before 2030, where do we see our priorities? Now with also the COVID, it has actually exacerbated the importance of the work that we do together and where we prioritize our efforts. And we have a hashtag Build Back Better, meaning we all talk about going back to normal or to before, but do we really want to go back to exactly the way it was before, or do we want to go back better? And I would say from a mental health aspect, this becomes of vital importance. How do we ensure that mental health is integrated into our health systems and not seen as a tangential issue? So also, as already highlighted, when we talk about health, a lot of times people think about physical health, which is of course critical. And so having a comprehensive understanding of health, where mental health becomes a key aspect of that, is what we will be discussing today. In fact, in the United Nations in May 2020, we released a policy brief related to the impact of COVID. And the title of the brief is COVID-19 and the Need for Action on Mental Health, recognizing the importance and the critical nature of this health crisis that we're in, that goes beyond the COVID impact itself, but the impact that it's having across the globe on many health aspects, including mental health. And 3 key action points that have been identified are applying a whole of society approach, where we promote, protect, and care for mental health. So this is an inclusion of mental health with psychosocial considerations and considering the response of COVID nationally, as also Her Excellency raised in her intervention. Secondly, we have to support the recovery from this pandemic by building mental health services for the future. So we have to recognize that we don't have sufficient mental health facilities across the planet. And I think our colleagues from WHO will be touching upon this. In addition, we have to ensure widespread availability of emergency mental health and psychosocial support, and recognize that many things related to mental health cannot be delayed. And if my memory serves me right, I recall reading publications from our WHO and UNICEF colleagues talking about the impact on children when they don't get services, for example, mental health services in time, the long-term impact on their development. So just as an example. So it's not something that we can delay. Additionally, this crisis has shown that the pandemic has given distress across the planet. And several surveys, for example, done in China and the USA, have shown that distress levels have increased by 35 to 60% in some countries. And maybe everyone, I don't know. I mean, the thing is, we know, because as I said, and I have no shame in saying that personally, I struggled during the quarantine period, and knowing that if it impacted me and I didn't feel well, that obviously it's impacting people everywhere that don't have as fortunate a situation as mine. Now, this year's World Mental Health Day, as the title of our discussion indicates, is greater access for everyone, everywhere. Again, I've stressed many times in my discussions after the pandemic that this pandemic has brought to our attention that we are all interconnected and there is no difference. The COVID has shown us that there is no discrimination on anyone, and how many things that we deal with on a daily basis affect everyone. So it's not about just specific parts of our population, but everyone, everywhere. So this is a very good title, I think, for this mental health celebration. I also want to bring to your attention some other items that we have engaged as the United Nations. And for example, there's the psychological first aid, which will also be touched upon by my colleagues. And these are different guidance that are provided in addressing mental health. And then we also have the issue of social media and the impact that social media has been having on our mental health, especially for children and adolescents. This can't be ignored as well. We all speak about these things, but I think during this year, we've seen how this can have a very detrimental impact. Within the UAE, as I already said at the beginning of my intervention, we're very happy to engage with the UAE in their efforts, and especially the Supreme Council, who has prioritized this issue for further action, as demonstrated through, for example, this conference that will be held next year, but also other work. And our colleagues in UNICEF and WHO are heavily engaged, and we look forward to further supporting the UAE in these efforts. So I encourage us all to embrace this issue and to take it home. And for those of you who are listening to this presentation, to make sure to disseminate some of the findings or things that you learned from today to your colleagues and your family, because it is through that dissemination and sharing that we also take away the stigma that is placed around the words mental health. To know that this is part and parcel of who we are as human beings, and we can't ignore it. So we say mental health for all, involving all, as a motto that we are using in the United Nations. And I look forward to listening to the discussion today. And I remind you again of our UN75 survey, UN75.online, where we'd like to hear from you on the priorities for the world we want. Thank you very much for this time, and I look forward to discussion today. Thank you. Over to you, Sajid.
Thank you, Dr. Dena. Really, I can see Dr. Shekhar applauding. So really, we really appreciate your leadership. And I remember the first conversation we had on this issue, and you were, fully there to support. We also see the vision that you have in terms of integrating this into, the whole Build Back Better process. The focus on services. So the UN leadership, I think, is fully required, and we're glad to see it's there. Both WHO, UNICEF, we're happy to be, to be part of this process. You also mentioned social media and protection issues. So in fact, as part of the UN75 talks, the next theme we would be dealing with would be online protection and engagement. So what are the opportunities, but what are the risks associated with it? And we'll also work with the Supreme Council for this, but that should be another opportunity. You referred to stigma. I think the more we speak, the better. Mental health is not, different from any other issues, but, there is a lot of resistance, and we have seen a lot of progress over the past many decades, but we have miles to go. So thank you once again. So with that, we'll move on to the panel discussion as such. And the first part of it is mostly on adolescent mental health and the interface between child protection and mental health. Sometimes we are like, how are these two domains related? And Dr. Seshadri sees it very clearly. Just to introduce Dr. Seshadri, like I said, if you talk about mental health in India, he is one of the first names that come up. And he is the Senior Professor, Department of Child and Adolescent Psychiatry, and Associate Dean of Behavioral Sciences at NIMHANS, one of the most leading mental health institute in the country. So apart from this work, he's also very actively engaged on issues of developmental disabilities, juvenile justice, violence, trauma, abuse, children in difficult circumstances. In short, just the person that we need to listen to at this point, to guide us more in this area of work. So over to you, Dr. Seshadri.
Thank you very much, Saji, for this generous invitation. Greetings, friends, on the occasion of World Mental Health Day 2020. Greater investment, greater access. I have some opening issues to share with you. Friends, mental health is a ticking time bomb, and COVID has only accentuated the seriousness with which we have to address this issue. Secondly, let us understand that COVID has a disproportionate impact on the more vulnerable populations. Third, look at what COVID has done in terms of the changes that it has caused in our internal and our external ecologies. Let's look at it from the perspective of children and adolescents. Loss of routine, loss of structure, loss of predictability, loss of educational opportunities, loss of social spaces, loss of peer interaction, and loss of play. Much as online has come to stay, what does this loss of ecology actually do to children's lives and adolescents' lives? What does it do to children with special needs? If you look at the combined percentage of children and adolescents of various forms of disability, locomotor disability, autism, intellectual disability, we are talking about 10% of the population. And what about their needs? And this is the reason why mental health is going to be a major agenda as we navigate the unpredictable road to public health recovery from COVID, because the economic impact of COVID, particularly on daily wage workers, migrant workers who have suffered loss of livelihood in the low and middle income countries, only accentuate the child protection risks that Saji referred to. The risk of child marriage, the risk of child trafficking, the risk of child labor. It is in this context that we at the National Institute of Mental Health and Neurosciences have recently initiated a national initiative and integrated resource for child protection, mental health, and psychosocial care. And I present to you, friends, the mandate of this project because it's an indication of what greater investment and greater access means in the context of public child mental health. Through this initiative, we wish to work with the health, education, and welfare sectors. Why these sectors? Because for every one child that manages to reach a tertiary care mental health facilities, there are 99 children who will never manage to access mental health care. Because we want to work in all these spaces that children inhabit and occupy, which means we wish to work with education boards, schools, teachers, childcare institutions and their staff, frontline workers in both governmental and non-governmental agencies that provide what has already been referred to as first level response or psychological first aid Her Excellency Falasi referred to this, as did Dena. I have taken the liberty, ladies and gentlemen, to put on chat both a website in which our last 5 years of public mental health work with a repository of field activities are there for free access in public domain. We do not believe in copyright, we believe in copyleft. Please feel free to use and adapt it. I've also put down the YouTube channel of this initiative where we are doing a lot of public health programs focusing on challenges of parenting. We did a series called August Talks, which was about child rights, child education, child mental health, and a new definition of loss in the context of COVID. So we want to work with the judiciary, legal services authorities, the police, administrative authorities, all service providers and stakeholders in every sector. And interestingly, this initiative is not supported by the Ministry of Health. It is supported by the Ministry of Women and Child Development. And there you have an example of what we mean by greater investment. Having said this, let me quickly take you to the essence of what I wish to share. Saji, I'm not able to. Yeah, now I am. Thank you very much. If you look at the UNICEF report and look at the parents' report on children's difficulties during COVID, of course, this is data from Europe. Look at the kind of findings of loneliness, of nervousness, of restlessness, and irritability and difficulty. When Her Excellency Falasi referred to the various behavior issues that we see, we must understand that behind every behavior, there is an emotion. Behind every emotion, there is an inner voice. Behind every inner voice, there is an experience, and behind every experience, there is a context. And therefore, psychological first aid is not just about responding to the manifest behavior, which is only an end result of a whole process where context begets experience, experience begets inner voice, and inner voice begets emotion. So 5 children in exactly the same context of COVID and confinement, depending on the kind of experience that they have as part of that confinement. Perhaps one child comes from a family which has pre-existing marital and parental discord and domestic violence. Perhaps another child has a single parent family who's struggling to make economic ends meet. And their inner voices could be one of, when will this last? How long will this go on? And intolerance of uncertainty is the central psychological construct that is going to occupy all our lives as we go ahead in negotiating this pandemic. If the inner voice is one of, this is hopeless, it will not last, the emotion is one of fear and anxiety, and the behavior is one of withdrawal. If the inner voice is one of, I'm not able to tolerate this, this is too much, the emotion is one of irritability, and the behavior then is one of disruptiveness or anger outbursts. And psychological first aid, therefore, has to negotiate this entire journey between context, experience, inner voice, emotion, and behavior. Having said this, we started a helpline, and just look at the figures only in the first month of the lockdown in April. Nearly 7,000 calls pertaining only to issues dealing with children and adolescents. So this is the kind of magnitude that we are talking about and the kind of responsibility we have to create and generate greater investment and greater access in child mental health. Finally, I'd like to share with you the kind of pathways to vulnerability as it affects children and adolescents. Please glance, friends, at the underlying causes. If you look at emotional factors like parental discord, domestic violence, abuse at home, punitive parenting, or experiences of loss and death, all of which have been referred to by Her Excellency and by Dena Assaf. Look at deprivation and neglect in low and middle income countries and the lack of early stimulation and growth opportunities, particularly its impact on children with special needs, educational issues and learning difficulties, experiences of corporal punishment and bullying, again, something that Her Excellency referred to, life skills deficits, peer influence, substance use, child labor, and pre-existing neurodevelopmental issues such as anxiety, depression, attention deficit hyperactivity. Now, if these are underlying causes, they generate immediate causes such as emotional dysregulation. We know that children exposed to chronic trauma have neuroregulatory problems, both in terms of anxiety and anger. There are developmental delays, school dropout, limited ability to process and solve problems, inability to contend with peer pressures with refusal, negotiation, and assertive skills, and engagement in antisocial behaviors, experiences of neglect and loss of attachment relationships, and social skills deficit, all of which only increase the protection risks and psychosocial issues and mental health problems. Now, this is the framework that we need to keep in mind in generating public child mental health approaches to handle both pre-existing agenda of child and adolescent mental health, as well as new agendas that are imposed on us because of COVID. Finally, friends, greater investment means we work with service institutions that children routinely use and attend. These are not just mental health institutions, these are childcare institutions, these are schools, and these are public spaces that children inhabit and occupy. Greater investment in training and capacity building of field workers, frontline service providers, greater investment in government systems for care and protection and greater investment in secondary, tertiary mental health care facilities to scale up the training in child mental health interventions, and greater investment in legal systems and judiciary and other stakeholders in the government. What does this mean for children? Look at the categories of children we are talking about. Children in conflict with the law, children with chronic illness, children from dysfunctional families, school children, children with gender and sexuality vulnerabilities, young children, orphaned and abandoned children, children with disability, and children from child labor and sex trafficking locations, and indeed the large group of children and adolescents who exist out there who have been impacted by the COVID. Friends, this is the time to act, otherwise the time bomb is likely to explode. Thank you very much for your attention. And let me get out of slide share. Thank you, Saji, for this opportunity. Over to you.
Thank you, Dr. Seshadri. Thank you very much for joining us. And I think you have clearly shown through your presentation and your introduction how mental health is just not about mental health system, but it's also about what we do, in all the sectoral interventions, and especially when it comes to children in vulnerable settings, So some of those vulnerabilities varies from place to place, but even in a place like UAE, with increasing exposure to online presence, how that could be impacting on children's well-being. The thing that you spoke about in terms of engagement, play, peer support, all that I think is coming up in a big way. So I think this is a conversation that would not stop here, especially as UNICEF and other actors, as we seek to see complementarities between the mental health domain and the other sectoral interventions, say in child protection. I think there's a lot more discussions to follow. So thank you very much for your insights. It's been very, very inspiring, and I think, we look forward to more interaction. So with that, I'll move on to the next speaker, Dr. Saed. He is currently the Regional Advisor, Mental Health and Substance Abuse at the Regional Office for WHO. But he also, I think, brings about 26 years of experience being a consultant psychiatrist, if I'm not mistaken. So he would know what he's talking about, when it comes to mental health. And he'll focus a lot on investment, the subject of today's webinar. So Dr. Said, thank you for joining us as a co-organizer for this webinar. And over to you for your presentation.
Thank you very much, Saji, and thank you very much for all the colleagues for inviting me to join this seminar or webinar, as we would like to call it these days. So I'll be focusing on the sort of case for mental health, that why do we need to invest and what's the rationale behind this theme for the World Mental Health Day this year. Basically, if you, I don't know why is it not working. Yeah, so the case for mental health basically rests on 4 pillars. The first one is the epidemiological pillar, that just look at the sheer number of people with mental health problems across the world. And as I think some of the previous speakers were alluding to, that no section of the population is immune. It affects everyone. So if you look at close to 1 billion people affected, and given the region we are living in, where we have countries like Syria, Iraq, Somalia, Yemen, Afghanistan, and so on, which have been going through protracted emergencies in the last 30 to 40 years. There, if you look at the rates, that more than 20% of the people who had adversity in the last 1 year would be having a mental health problem. And it is not just that people would have with mental health problem have their own issues and needs, but the fact remains that mental health is an integral part of health. If you just look at the definition of health, it includes that. And on a concrete level, it means that there is a bidirectional relationship between mental health and the other domains of health, be they social or physical. And it can be seen that if you look at the rates of mental disorders in people with chronic physical illnesses, whether they are NCDs, whether they are HIV or tuberculosis or hepatitis, the rates are far higher, in some cases more than double what you would see in general population. At the same time, the reverse is also true, that people with mental health problems are more vulnerable to develop chronic physical health problems, and at the same time are more likely to engage in unhealthy behaviors like smoking, poor nutrition and diet, use of alcohol and so on, and lack of physical activity, which make them more vulnerable to develop that. And the end point is that they are more likely to have shorter lifespans, and they tend to die 10 to 20 years earlier than the general population. So that is one. And what I think people were alluding to, it's also important to remember that bulk of the mental disorders in adults have their onset before 14 years of age. So that's again the case why we need to focus on child and adolescent mental health, and at the same time, why focus on maternal mental health at the same time. And in addition to that, I think it's also important to remember that mental health problems, generally speaking, are construed in terms of disability. 1/3 almost of the total disability worldwide is because of mental health problems. But we tend to forget that it also results in uh, high rates of death. Just look at the figures that close to 1 million people die of suicide, and it's one of the leading causes of death in the young people across the world, just following on road traffic injuries in lots of countries. Similarly, people with substance use disorders, alcohol use, and so on, they are again have they are much more likely to die prematurely. Just look at some of the figures. This is one of the reviews which we have just completed, and it's still, I think, it's still not published. And you would see that the rates of common mental health problems are in no way different from what you are seeing globally. The rates are about the same as you are seeing across the world, except you would see rates of depressive illnesses are far higher, as well as in case of post-traumatic disorders, the rates are far higher, which are entirely because of the countries going through difficult circumstances these days. In addition to that, you would also see that the rates of suicide traditionally have been fairly low in this region. And if you look at the current rates, it's around 4.8 per 100,000, which is about less than half of what the global median is at this point. But we also need to remember that most of the countries do not report in this region on suicide. So most of these are projections and estimates which we are having. And at the same time, these mental health problems are among the most common causes of disability adjusted life years lost in this age range between 10 to 19 years in countries of this region. So you can see depressive illness and this very sort of odd term of collective violence and legal interventions, which does include suicide and anxiety disorders, are among the top 5 causes of disability adjusted life years, both in case of males and females. And similarly, some of the estimates which we have from Middle East and North Africa region show again that the rates of anxiety disorders and autism, in some case, particularly in case of males, are slightly higher in this region than globally. So that's the first pillar, the epidemiological reason why we need to invest in mental health. Just the sheer number of people being affected and leading to poor quality of life and early death. The second is this issue of stigma, discrimination, and human rights abuses, which are rampant across the world, and particularly so in low and middle income countries. And these are some of the pictures which I'm sure some of you would be familiar with who have worked in the systems. The third is the issue remains that despite the burden of disease, despite the human right abuses, stigma, and discrimination, the fact remains that countries do not spend enough on mental health. It's in no way commensurate with the need. Generally speaking, most of the countries, particularly low and middle income countries, spend around 2% of their health budget on mental health. I'm not talking about the overall budget. I'm just talking about the health budget when in lots of countries, again, dismally low. So only 2% of that is going towards mental health. And at the same time, only about 1% of the health workforce in most countries is working in mental health. And what does it result in? We are also seeing that in terms of economic losses, about $2.5 trillion annually are lost because of these problems. At the same time, it's not just that the amount of money is not spent, the amount of money spent is being extremely less, But the problem also remains as the spending inefficiencies and allocative inefficiencies. That most of the money which is allocated for mental health goes towards maintenance of big institutions and big hospitals instead of being spent on community based services and institutions. And similarly, developmental assistance is only around 1% of the assistance going into health. So, what does it lead to? It leads to the fact that 76 to 85% of the people who need help do not get help. And this is as high as 90 to 95% in some of the countries in this region. And this is not only true for low and middle income countries, but it's also true in case of high income countries. And this, just I am putting it as a comparison, that if you look at the people who get help in low and middle income countries for chronic disorders like diabetes, heart disease, and asthma, and you just compare it with the people who get help for mental health problems, even in high income countries, you can see a marked disparity. Then I think speakers have already alluded to this fact that COVID 19 has thrown these discrepancies and these challenges into sharp relief. At the same time, obviously, that has also meant that attention has focused to some extent on mental health as an extremely vital issue. And I think Dena Assaf was mentioning already the UN Secretary General's brief on COVID 19 and mental health, which did show that large proportion of populations have experienced distress. But at the same time, we also know that from some of the studies carried out in this region and other countries, that the rates of depressive illness, for example, are between 16 to 22%. For anxiety disorders, as high as 33% are being reported in some countries. And for the children, I think Dr. Shekhar has already shown you that particular slide from Italy and Spain, showing the parents reporting very high rates of different symptomatology among children and adolescents. So that is, so what we also wanted to look at was that how was this impacting countries in this region? And we carried out this rapid assessment to see the services which were disrupted. And as you can see from here, that the top 5 services which were disrupted, including psychosocial interventions, services for children and adolescents, outreach and community-based services, and at the same time, the school-based mental health programs in different countries of the region. In most cases, these were primarily because of the measures which were brought in to mitigate the spread of the COVID. But in some cases, obviously, it's also important to remember that the clinical staff was deployed elsewhere. There was stock out of essential medicines, and services were simply not available because some of the units were repurposed for treatment of COVID-19 patients. But as I said, that this also provided an opportunity, and you can see here that almost all the countries in the region instituted some innovative measures and started using technology. So helplines, self-help and digital format of psychological interventions, sort of consultations and teletherapy, they were instituted in majority of the countries. In addition, what was also important is that in some cases, additional staff was recruited. And what we have been advocating for a very long time of task shifting and role delegation, that also started picking up momentum in different countries. Besides provision or training of healthcare workers on provision of basic psychosocial interventions, which include PFA, but in addition to that, it might be good for people to remember that we have already launched a basic psychosocial intervention package for frontline workers, which is available online, and we'll be happy to help out with the training on that. We are also developing a regional mental health platform. Some of you might be aware of it and people can access it. It includes specific provisions for frontline workers besides some of the stress-related, stress relieving exercises and measures for general population. So coming back to the main issue, that as I said, that there were four main pillars: the epidemiological pillar, stigma and human right imperatives, then availability of cost-effective interventions, and at the same time, lack of investment in resources for mental health. So it's also important to remember that investing in mental health is not something which is just sort of whim, which should be done. It has concrete, hard evidence behind it. So investing a dollar in treatment of anxiety or depression would give a return on investment of $5. And for substance use, it's a bit higher. In case of alcohol interventions, it can go as high as $18 for per sort of dollar spent. And also important to remember that we are not asking for huge amount of money. If you look at what is needed for a basic package of mental health services, it's just between $3 to $5 per person per year. For low and middle income countries, and for upper middle and higher income countries, it's slightly higher. And it's also important to remember that no one is saying that you have to spend all this money in one go. You can spend it over a period of time. So even if you're looking at a country of say 100 million, and you have to spend $500 million a year, you don't have to spend it in 1 year. If you spend it over a period of 5 years, because the system has to be able to absorb this additional money, and the resources, human resource development, the infrastructure resources development, setting up of services would take some time. So you don't have to spend all this money in one go. So it would take some time for this money to be absorbed into the system. And generally speaking, almost any country would be in a position to spend, say, $100 million a year additional on what they are already spending. There are hardly any countries at this point in this region. $100 million for a country budget is peanuts, actually. And what do we need to spend it on? As I said, that initially, that whatever money is being spent, it is also being marred by allocative and spending inefficiencies. So we need to spend it efficiently on proper evidence-based policies and laws to be brought into place, and at the same time making sure that we increase access through integrating mental health into across the healthcare system and the social care systems based on where the evidence is for interventions. And we have this regional framework which highlight based on the Disease Control Priorities Project, which has identified that what are the most cost-effective interventions across health systems, across population platforms, and across community platforms. So that's what we are sort of suggesting, that instead of investing in sort of whimsical interventions, we spend the money on evidence-based, cost-effective interventions to support and strengthen the health systems across the board, and at the same time institute monitoring and evaluation to document what change it brings about. So I'll leave you with this list of resources which are available, and some of them which I've already mentioned to you earlier on. So please feel free if there are any questions, any queries, and with that I'll hand over back to Dr. Thomas. Over to you.
Thank you, Dr. Saed. Extremely, rich presentation. And I think what I really liked is the way you ended with, the doability of it, because, you say it costs 2%. And if it costs massively, I'm sure, the actors, especially governments, will not be interested in looking at it. So I think you're kind of saying the resources required can be spread over a period of time, and then also look at evidence-based, interventions. And, and sometimes some of these resources for many of these countries in the sub-region is not much. So I think there is a case to be made, just using what you have presented, for further advocacy. The pillars that you initially presented on, just the sheer numbers, should in itself be a compelling reason, and also an appeal from the human rights stigma aspect. I think it's again quite compelling. So just to say that, just by going by what you presented, there is so much that we can consolidate to make a case with various actors, but also engage public. You spoke about helplines and other online platforms. So thank you once again, very rich presentation. Don't see too many questions, but Dr. Reem had a query, and Dr. Reem, over to you. Sorry, Her Excellency Reem, if you would like to come in with your request and a question. And if there are others, please put your hand up, or just type in your question, and then we will go back to the panelists. But Her Excellency Reem, over to you.
Thank you very much, Saji. And thank you, Dr. Shekhar and Dr. Saed, for the very much insightful presentations. They were very much interesting. I was wondering if it's possible if you can share the presentations with us, the resources. And Dr. Shekhar, you mentioned a program that is a public health program that is available online. Can you please let us know what it's called again, and give us more details about it? You said there's a YouTube channel and other accessible information for families.
Your Excellency, I have already posted them on chat, but I would be happy to send it on to Saji. Both the website, which is a repository of all kinds of field activities, assessments, workbooks, manuals, reports on disability, on abuse, on trauma, on basic counseling skills, on bullying. You name it, we have it. It was developed after 5 years of field work. And the YouTube channel is our latest project on child protection, mental health. We completed a series called August Talks, focusing around COVID, but addressing child rights, child education, and child mental health. We are just finishing a series now, 9 programs are over, called Parenting Pathshala. Pathshala is a Hindi word which means school. So translated, it means a school for parents. And it looks at the challenges of parenting children with special needs, parenting in the context of issues of discipline, in the issue of violence, substance use, adolescent relationships and sexuality, substance use, and so on. And we are going to soon start a series on child protection itself. All of these are available in public domain, and all our training materials are available in the website that I've put on chat, but I'll be happy to forward it to Saji and have him forward it to you. And as a national institute under the government, Ministry of Health and Family Welfare, it's our obligation to support not just India and not just the South Asia region. And this is a commitment I would like to make, Your Excellency, also a commitment to Dr. Syed Khalid. Any way in which we can assist in supporting the mental health of children and adolescents, particularly where conflict is concerned, we would be happy. It would be an honor and privilege to assist, Your Excellency and Dr. Khalid.
Thank you very much, Doctor. We really appreciate it.
Thank you, Dr. Shekhar. Please come in. Go ahead, Dr.
Fine, as I said that, I think we'll obviously be sharing the presentation. And at the same time, I think it might be a good idea if people can visit our website and have a look at all the different resources, which I have already alluded to in my presentation. They're available online, and obviously WHO's resources are for free. So please take some time and have a look at what is available in terms of school mental health, in terms of resources related to COVID-19, and overall on how to integrate mental health into primary care. So all different kinds of resources are available. Over to you.
Thank you, Dr. Said. There is a question from Ahlan. So thanks for the presentations. At the level of individuals as parents, what can we do to enhance the mental health of our kids, especially during the COVID-19 period? Any suggestions? I'm sure, yeah, Dr. Shekhar, if you would like to come in, or Dr. Said. So what can we do as parents to enhance the mental health of our kids, especially during the COVID? It's just not Ahlam, I'm sure, who's asking this question. It's just practically all of us. Over to you.
Uh, Thank you very much. Dr. Syed, shall I go first? Right. Thank you very
Go
much.
ahead.
Yeah, thank you. So here is a framework for the whole issue of parenting, COVID, and the social isolation. Rudolf Steiner, the Austrian philosopher who founded anthroposophy, there is the anthroposophic practice of medicine, the anthroposophic practice of education in the Waldorf systems of school, and the anthroposophic approach to adults with intellectual disability in the form of residential communities called the Campbell communities. Now, the anthroposophic approach to parenting is well exemplified in what parents can do during COVID, particularly for children with special needs. If children cannot go out into the world, how do you bring the world back into the family? And anthroposophy is about working with nature, working with materials, with craft, with music, with movement. And even for very young children, it's a question of a small pot with a little sand or mud, and you throw in a couple of coriander and mustard seeds and allow the child to nurture it, and it germinates in 3 days. And the whole notion of nurturance of nature and of growth. It's about putting two chairs and putting a bed sheet over it and some orange lights and a jug of orange squash and putting in some music and imagining that you are in a beach resort. So it's a question of catering to children's imagination and meeting their developmental needs, particularly because access to socialization and social experiences are not there. And so you provide those. This is one part of it. The second is to rediscover new family rituals and routines, because ultimately, childhood memories are memories of things that happen very often, good things, bad things, some catastrophic things. And how do you create rituals by which children can remember 2 years from now, 5 years from now, 10 years from now, that there was this thing called COVID, but we did wonderful things at home? And which is why, if you ask any 35-year-old person or 40-year-old person, what do you remember about your childhood? You will remember that which is a stable memory. So, you know what I remember about my childhood? I remember in my home, I had this 100-year-old antique bell, and it was my job to ring it during meal times, and the family would gather, and we had fun and laughter. And now, at age of 35, it has pride of place in my house. You know what I remember about my childhood? We had a tradition every week to go to the nearby orphanage and do some service. And that's where I got my inspiration to do social work. And here I am in the ministry, heading the social welfare sector. Do you know what I remember about my childhood? I remember every day thinking, why the hell was I born in this family? All I remember about my childhood is night after night putting my ear outside my parents' door to listen whether they were killing each other or not. So this is another thing you can do. Third is the culture of conversations. What is the nature of adult-child relationships? Unfortunately, friends, adult-child relationships are built on a culture of instruction, expectation, and obedience, not on a culture of conversations. In many countries, in many cultures. But if you have a culture of conversations, then children's anxieties and concerns are articulated and you respond to them. So this is the kind of stuff that you can do. 5 things about mummy and daddy that you never knew. 3 things that we can plan to do. 5 things that we can do to redecorate the house. 2 things that we can do to keep, your education and your inputs going. 5 things that you can do to support each other. So we find new rituals to really vitalize the family. And these are some examples that you can take on board as we go along uh, with this uncertainty of when the second wave has already started in many places. UK is locking down in many places. Infections are spreading and raging, as in India and as in Bangalore, where I live. And so this is going to continue till the vaccine arrives, and even then, from the kind of numbers we have in India, for example, will we have enough samples of the vaccine to really vaccinate all the people? So these are some challenges of parenting which we can easily address by embracing anthroposophic activities, the reclamation of routine and structure and predictability, and to look at maintaining meaningful relationships and communication and contact with the extended family. Over to you, Sajid.
Thank you very much. Actually, we just have about 11 minutes left, so we'd like to conclude. But there's just one question which probably Dr. Saed can answer. Anuj is asking if, as healthcare provider, how can we screen for mental health in children as well as a child well visit? Is there any standard screening tool? So basically, is there a standard screening tool for children at child visits for care providers?
I mean, the simple answer is no, that there is no single standard screening tool available. Okay. So I would just like to go back to the previous question, if possible. I think what we need to remember is that children learn from us as parents or as adults, not only by what they hear, what we are saying, but also by seeing what we are doing. So we are also role models. So it's extremely important for parents to understand how they behave would have an impact on their children. And at the same time, they need to encourage their children to talk about how they feel, what they have gone through, what information they are getting and where they are getting it from, so that they can correct that or provide them with more reliable sources of information. So because that's one of the things which is coming out, and I think was alluded to earlier, this infodemic, that you are getting all kinds of information, right or wrong, and conspiracy theories going all over the place. And particularly with the schools opening up, in most of the countries of this region, it's important that parents should also engage with teachers and jointly should agree on how this information should be provided, and at the same time, how children should be engaged in activities so that they are able to express what they are going through, what they are feeling, and where they would like to be. Right? So thank you very much, and over to you, Sanjay.
Thank you, Dr. Said. I think it's it's probably worth having another session on this with a lot more parents, and I don't know, maybe Supreme Council and the other partners can take it up, because today's discussion was quite focused on investment, and making a case for it, quite focused. But this conversation on parenting in this context, especially for mental health, I'm sure there'll be a lot of interest, a lot more learning to be put together. So we really have barely 10 minutes left. So I would go back to the last part of it, where it is more concluding observations. So if I can go to Dr. Rayana. Dr. Rayana is the manager, country focus and support for WHO. And she's also the desk officer for UAE and Qatar. So big responsibility in terms of strategic operational planning and implementation of the joint collaboration between WHO and the states. So if you can just quickly give us some concluding observations based on today's presentation, that would be great. Dr. Rayana, over to you.
Thank you very much, Sash. Thank you very much, Dr. Shakar, Dr. Said, Her Excellency Reem, and Dena, and all the colleagues. I enjoyed very much the session, and I know that the time can take still more hours to discuss this very interesting topic. However, as we all highlighted, that we have to look in the planning perspective towards a long-term discussion and long-term engagement on mental health, and how do we invest financially, invest also programmatically, and invest in our capacities to be developed to address the needs in such growing scope.
I know that Khalid mentioned the importance of the integration into the primary healthcare and the services to make sure that, at least from the health services perspective and delivery, we look at promotion, prevention, management of cases, for identification, first aid, in all kind of levels. But at the same time, we need to go back and say, what do we have at the national level in terms of a policy or strategy that's dedicated to address mental health in all the different angles and scopes and through the different sectors. And I think my colleague Eltayeb will touch on that. But what is important is to say that mental health used to be thought about like an addition or a luxury kind of program that we build in after the essential kind of services have been done. And what we have learned is that it is as much as a basis and an integral part of how we do services and what we do in health services in all the life course aspect. We touched a lot on children. I just want to make sure that children are parts of the whole, of families, of communities, and the interactions that need to be done when we look at it, we need to look at it as a whole of family kind of also approach, and whole of community and society, and the intergenerational lessons that we could have, and making sure that, as you highlighted, in vulnerable settings, sometimes we think that resilience is then born or is happened. But in vulnerable settings, this is where we have a need to give more attention and to give more effort and to invest more. I want to end with just a note that we need to look and do more research. We need to see how we have all managed with the evidence that is available, to learn more, to look at what triggers, what coping mechanisms we've had, what was the impact of culture, of different coping mechanisms, what worked and not. And also not to forget our frontline workers in all domains, really, and the support that we need to give. Thank you very much for allowing me to join and also to put on those few words. The way is long, the work is a lot, but we need to address it. Thank you very much together.
Thank you very much, Dr. Rayana. I think it's a good concluding remarks to begin with. Eltayeb, can I just ask you to come in both to conclude and also thank all the participants? Eltayeb, sorry, I don't think we can hear you, but of course, Eltayeb.
Yeah, I hope you can hear me now. Yeah.
Yes, we can hear you. But I was just going to say, for people who don't know Eltayeb, Eltayeb is the UNICEF area representative for the Gulf.
Thank you.
He has been providing support since 2018 to 5 countries in the region, and someone with over 25 experience of programming work covering Middle East, Southeast Asia, and Africa. So rich experience.
Thank you.
So just the right person to make the concluding.
Thank you so much, Saji. So I know that we have now just a few minutes. I'll try to be very brief. But just to say, I'm really very pleased, for today's discussion. It's been a provocative, stimulus, and rich discussion, which covered a range of issues, right from the importance of the issue of mental health itself. What does it mean for adolescents and children, and the good practices that came around, and what are the possible entry points, and of course, the need for greater investment and greater access, which is the theme of this year's Mental Health Day. So really excellent. I'm really very happy. I'm very pleased also to note the linkage between child protection and mental health that Dr. Shahsadri clearly articulated. As UNICEF seeks to expand its work on child protection in the United Arab Emirates and the region, we do realize the psychosocial support lends itself as a good entry point. And I think the Sovereign Council for Motherhood and Childhood and UNICEF already has clear plans for taking this work forward. And I'm very encouraged with the clear articulation that the vision from Her Excellency Reem and Falasi actually have kind of put together today in this meeting. Just to say thanks to the intervention from our WHO colleagues, and also from the UN resident coordinator in the United Arab Emirates, Dr. Dena, Assaf. It's clear that there is a need for focusing on building systems for mental health. With the openness and the conversation that has generated on mental health, there is probably no better time to review and start the process. Support from the leadership at the highest level, from the government of UAE and also from the United Nations, would really boost efforts to address the issue in country, in the region, but also globally. I think we discussed how also, the United Arab Emirates is reaching out to support regional and global efforts. To mention ongoing work on child protection in the United Arab Emirates, especially the development of a national strategy on ending violence against children, is one of the ways of addressing the issue. Strengthening child protection system, especially making available a dedicated social workforce for child protection, will be a critical intervention that will ensure support for children and adolescents. And just to say also, psychosocial well-being is about life skills. We are very pleased to see also the opportunities being explored with the Ministry of Education in the United Arab Emirates in this context. A life skill package integrated into the education curricula is a key for building resilience at individual level and at the level of the families and communities. Just let me summarize the outcome of today's discussion into three areas of action. The first one, increase investment in mental health and psychosocial support services, which are integrated with health and nutrition, education and child protection systems and other community services. The second one, increase investment in family-centered approaches through parenting support programs, promoting healthy family relationships and supporting caregiver well-being and mental health. And the last one, increase investment for schools and communities to ensure all children learn in a safe and secure environment. And there are these three areas of actions actually are related to the theme of today's webinar: mental health for all, greater investment, greater access. So let us ensure mental health for all by involving all. And I'm just going to say also, I'm very pleased actually by Her Excellency Reem Al Falasi's announcement of the mental health forum that will be held next year in Abu Dhabi. It's, I think, also will be contributing, to this, theme of today, which is increased investment and increased access. And UNICEF will be there to support this actually initiative. And at the end, I would like to thank all the agencies that have come together to organize the webinar. It's a good reflection of the excellent partnership of the UN and the UAE. I mean, how we're working all together. Here, I would like in particular to thank the partners of this event, the Supreme Council for Motherhood and Childhood, Her Excellency Reem Al Falasi, and also the Office of the Resident Coordinator, the UN Resident Coordinator, and our Resident Coordinator, Dr. Dena Assaf, as well as, of course, our panelist, actually, Dr. Sadri, also, as well as, our WHO colleagues. We have Dr. Saed and also Dr. Rayana for an excellent webinar. And, I would like to thank all the participants for all the forms of life who tuned today actually into this webinar. As we agreed, we need more time. We need maybe more webinars for this, important issue. By doing so, you are really supporting the call for mental health for all by involving all. Thank you very much.
Thank you very much, Eltayeb. So once again, excellent inputs, a lot of ideas. I'm sure there'll be a lot to follow up. I just want to thank all of you. I would say panelists, please feel free to unmute and have your videos on and stay on if you like for another few minutes. But thanks all the participants. There'll be more to come.
Thank you very much.
Thank you.
Thank you. Have a good day, everyone. Bye-bye.
Bye.
Thank you all. Thank you, Dena.
Thank you, Her Excellency.
Thank you, Eltayeb.
Thank you.
Very
Thank you,
much.
Rayana.
Great job.
مع السلامة.
Thank you, Dena.
شكرا
Yes.
جزيلا كثير. مع السلامة.
And we should have said, and even for those who are listening, we're creating a YouTube channel for us here in the UAE, UN, and so we'll be posting it so that people can go back and hear it.
That's very good. Yeah.
Maybe you can include it in the in the list for all those who have joined. Yes.
So thanks once again. It was good. Her Excellency Falasi, thank you once again. We'll be discussing more. Sheikh Shashadri, thank you for sparing your
Thank you.
Sunday for us.
Take care, all
Thank
of
you
you.
so much. Thank you so much, everybody.
Okay.
Thanks.
Bye-bye.
Bye-bye. Jalal, thank you once again. Okay, it was it all went well. Ala, the interpreter, Motas, the support.
Thank you, Sashi. Thank you.
Thank you,
all.
colleagues. Really excellent job. Thanks a lot again from my side. Also, Jalal and Mu'taz. Thanks a lot.
Thank you, Tay. Thank you all.
Jalal. Yeah. And we were time-wise also, we were just about okay. That's very good. Thank you, Eltayeb.